So far, your quality improvement journey has no doubt been one of learning a great deal of skills and QI techniques. And since the beginning of the QI Collaborative, you, as a team, have examined your service's performance, identified areas for improvement, implemented change ideas, and measured their success. Hopefully you've seen some successful outcomes as a result of your improvement work. And as a team, you've been able to develop a number of tools to enable you to continue to improve your service in this constantly changing environment that we see today. Think about how you've changed as a team, as you've worked together in the last few months. Are there any qualities or characteristics your team has developed through its QI journey to becoming a quality improvement team? And although the tools that you've acquired over the last few months are crucial in enabling you to do your improvement work, there's a number of characteristics that are common in constantly improving and learning teams. These are outlined in a really useful document produced by the Health Foundation. It's called Habits of an Improver. It's a useful guide to examine at this point in your improvement journey because it focuses on behaviours. Those behaviours which are common in quality improvement teams. It's also useful because it provides a framework in which you can examine your own team's behaviour and characteristics. The framework is divided into 5 core behaviours: influencing, resilience, creativity, systems thinking and learning. From each of these are 3 sub-behaviours. We'll explore these in a little bit more detail now. I'll run through this model through the course of this video, but please be aware that you and your team may have your own views on what particular parts of the model mean. Indeed, you may also have your own ideas as to what makes a habit of an improver. That said, in making this video, I have taken content from the Habits of an Improver document, as well as added my own viewpoint on what I think the behaviours mean. The first habit of an improver is that of influencing. This includes being empathetic, understanding people and different perspectives. Quality improvement involves a lot of different ideas and viewpoints. Perspectives may differ considerably between, say, a doctor, a dietitian, a youth worker, a patient, or between any individuals and groups. It's an important skill to be able to understand and include other perspectives as a continuous improver. Being facilitative. So much of our QI work involves working in teams. And being facilitative means enabling everyone to be able to share ideas and viewpoints. For example, during your regular meetings. Bringing those in who may not be as involved. Creating a space in which people feel safe to speak and share their ideas. And being comfortable with conflict. Change is hard and it's normal for there to be conflicting views when doing QI work. With different viewpoints and perspectives, not everyone will agree at times. And there will be times when people do have conflicting views. Being optimistic. It's a great improvement habit, is to be optimistic and having a growth mindset. Having a vision where you would like to improve and how you want your service to be. Calculated risk taking. I think it's fair to say that change ideas always involve an element of risk. Improvement ideas and change do not always go right or lead to improvements. A good improvement habit is to examine that risk and manage that as well as it can be. Tolerating uncertainty. With all the change, there's often changing levels of uncertainty and things do not stay the same for long. Examine this in your teams. What are reasonable levels of uncertainty? And do your expectations of uncertainty differ among different members of your team? On the creativity segment, we have generating ideas. As a team, you may wish to employ different techniques to generate improvement ideas. A good improvement team will often be asking what if about different aspects of their care delivery and constantly thinking and proposing different ways of doing things. Critical thinking, so using your reasoning, questioning and reflecting on your practices on a deeper level, team playing, being creative as a team, recognising the value of different perspectives. This gets a little bit more complex when we start talking about systems thinking. It's really useful to think about your team as a microsystem and how it interacts with the other systems around it, such as a wider hospital, other services, the patient group, parents. Synthesizing to observe patterns. How as a team you are making sense of your data and experiences. Being accepting of change. Be willing to break out of new routines and try something new. And finally, learning. Questioning. Constantly being curious about the way you're providing care and processes. Through problem finding, seeking to change difficulties and problems within your processes. By being reflective. This may be dedicating time you spend with your team to really inquire into the way that you work together and the care that you're providing. That you have a culture where things are open to analysis and review. There you have it. That's a very quick run through of the habits of an improver. For your activity, get your staff together, have a discussion based on questions on each side of this model. What will I do myself? What will we build into each meeting? Go through each of the behaviours. What are you good at as a team? Are there any areas in which you can develop? Are there any areas which you think might be holding your team back? As mentioned, throughout your QI journey, there may be other qualities and characteristics that you as a team have, you believe have helped you, but they might not be on this model. Please prepare your ideas for feedback on that fourth and final QI session on 10th of September. Look forward to seeing you there.